All right. Good afternoon, everyone. Thank you for joining us. I hope you enjoyed that. That's Utah's own One Voice Children's Choir. If you're not familiar with them, one of these days it's my goal to have someone say, "Hey, that's one of those was my students." I would love to have that. So if you know any of those kids, let me know. Um, I really enjoy starting these off with a little bit of music while people join us. But we're going to go ahead and get started today. We're really pleased to have you join us today to understand and support school-based mental health. That's our topic today. Ooh, see, my cousin's son. Yep, love it. Thank you. Um, okay, so we're going to go ahead and get started with Tara K. Bodley, who's our USBE school-based mental health specialist, and Ashley Lauer, who's our USBE behavioral specialist. Both here, both on the student support team, both experts, and we are excited that they will be able to get to share a little bit of their expertise with you today. And I'm going to go ahead and turn it over to Ashley and Tara Kate and let them go ahead and share their knowledge. Thanks for being here.
Thank you, Tanya. Thanks for sharing that video. I love seeing the kids here in Utah and love getting to hear their talent. And what a great song talking about to start us off today, talking about supporting students who may have a variety of mental health challenges, who may not be on that continuum somewhere at some point. So thank you for sharing that. As Tanya mentioned, I'm Ashley Lauer. I'm a behavior specialist on the student services team, and here with Tara Kay, who's really our expert as the school-based mental health specialist, and we really appreciate you being here today. We're excited to provide you with some information that will help you better understand and support student mental health in your schools. This webinar today is really designed to be practical and supportive. Our goal is not to turn you as educators into mental health professionals, but to help you better recognize signs of concern, understand common mental health challenges students may experience, and feel more confident using everyday strategies to support student well-being in the classroom. As we move through this presentation, we encourage you to reflect on your own students and your own experiences, and we'll discuss many small relational based practices that can make a big difference over time. So before we dive in, we want to be clear about our learning intentions for today. Our goal, first and foremost, is to provide you with foundational understanding of student mental health. This means building a shared language and framework, so we're all talking about the same things as concerns arise. We'll also spend time discussing the mental health continuum, talking about how mental health isn't an either-or situation, but how students move along a continuum and understanding that helps us to be more effective in the way that we support students. You'll learn about common mental health disorders in the school setting, along with key signs and symptoms. Again, this is about recognition, not about diagnosis. A major focus of today will be focused on practical classroom-based strategies. These are things you can realistically implement to support students and help prevent concerns from escalating. And finally, we'll talk about relationships and inclusive environments and how those play a crucial role in supporting student mental health. Often the most powerful strategies are the everyday interactions you already have with your students. So let's start by grounding our conversation in a shared definition of mental health. So according to the USBE, mental health includes a person's emotional, psychological, and social well-being, and it impacts how someone thinks, feels, and acts. It also influences how we handle stress, relate to others, and make healthy choices. In schools, that really matters because mental health can show up in learning, it can show up in behavior and relationships, and the way a student might engage in the classroom. It influences how students respond to challenges, interact with peers, and how they access instruction. When we as educators share a common understanding, we're better equipped to respond with support rather than with punishment, and that will kind of be our focus today. So before we move on, we're going to pause and watch a short video This video provides kind of a less formal definition of mental health, and it also introduces us to two key factors that can help either support or weaken mental health. As you're watching, we want you to pay attention to how these factors show up in everyday life. Think about how they might show up in your classroom or within your school community. Okay, let's watch this video.
Mind Matters in Minutes. What is mental health? Part 1. A definition. If a student came up to you and said, "What is mental health?" how would you answer them? Maybe you'd say, "It's obviously being mentally healthy, isn't it?" To which your student replies, "That's a tautology. It doesn't mean anything." And they'd be right. So maybe you'd say mental health is to do with things like schizophrenia, depression, anxiety. But that's a list of disorders. It's not mental health. So maybe you say mental health is being happy. But then happiness is just a mood. Our lives are full of positive experiences that have nothing to do with happiness at all. So what is mental health? Here's one definition from the World Health Organization. Mental health is a state of well-being in which the individual realises his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Now that's good, but it's long. We could boil it down to this. Mental health is our ability to respond to challenges. What kind of challenges? It could be anything, from a sudden encounter with a tiger to anticipating an exam. It could be something physical like an illness, something social like bullying or being left out. It could be an all-consuming crush on someone or a to-do list the size of a shark. It could be arguments with your family or a difficult essay, or the death of a parent, or a long-distance move. The fact is that life rarely goes according to plan. And whenever we are beset by the slings and arrows of outrageous fortune, mental health is our ability to bounce back and stay on course. Now, how do you get this ability? Are you born with it? No. Mental health can change, and the things that tend to shape it are called risk factors and protective factors. Protective factors, such as a sense of self-efficacy, a supportive family, or strong friendships, tend to cushion and support you, making it more likely that you'll maintain a state of positive mental health and stay on track. On the other hand, risk factors such as chronic illness or low socioeconomic status can have the opposite effect, exacerbating the impact of disruptions in your life and making it more likely you'll experience a decline in mental health. The good news is that protective factors can offset risk factors. And even better news is that protective factors introduced in early years can help shape positive mental health across a person's lifespan. So if a student asks you, what is mental health? You can say mental health is a state of mind that allows you to cope with the endlessly inventive challenges life throws at you, and that state of mind can be at any time eroded by risk factors or supported by protective factors. That's a great explanation, and your student will love and respect you for it. But it does raise another important question. If you wanted to improve the mental health of as many people as you possibly could, what do you think would be the best time and place to do that?
I love that video. I love how it boils things down into really simple terms, right? First of all, talking about mental health is the way, the ability that we have to cope with the challenges that life faces. And then if you've been to any of these webinars, they talk a lot about protective factors. And so this kind of talks about how protective factors and also risk factors interact with and influence the way that we experience our mental health, right? Again, along that continuum from mental wellness to mental illness and everything that comes in between that. So as we're talking about this, we talk about, right, the protective factors, such as the family support, the strong friendships that act as a cushion and support our well-being, making it easier, in this case, for our students to cope with stress and challenges. And then also these risk factors like chronic illness. They also mention low socioeconomic status that can worsen the impact of life's challenges and increase the chance of a decline in our mental health. So one important key takeaway from this video is that these factors are always influencing mental health. Students are constantly moving along that continuum depending on what supports or stressors are present at a given time. So in a few slides, we'll talk a little bit more about protective factors and how we as educators can be a powerful protective factor for students and also help them to build supports when they otherwise have been limited in the past. So why does this all matter within the school setting? It's important to recognize, as we've kind of talked about, that mental health directly impacts a student's daily functioning at school, including how they learn, how they interact with peers and adults, how they manage frustration, stress, and expectations throughout the day. When a student is struggling with their own mental health, it often shows up in the classroom and school. You might notice difficulty concentrating. You might notice a student's increased emotional reactions, withdraw from their peers or adults, or challenges with regulation and problem solving. These behaviors can be signals that a student is overwhelmed or struggling internally. Mental health disorders also tend to have distinct behavioral patterns. It's important because behavior is often our first indicator that something deeper may be going on. Noticing patterns over time, especially behaviors that are persistent, intense, or different from a student's typical baseline, helps us respond early and appropriately. It's important to emphasize that recognizing patterns does not mean diagnosing. It means observing and responding with support and empathy while following school processes when additional help may be needed. Early recognition leads to early intervention. When we notice concerns early, we can prevent escalation, we can reduce the need for more intensive supports later, and help students access the right support at the right time. Finally, raising awareness among educators helps create school culture where mental health is acknowledged, students feel more comfortable asking for help, and adults respond proactively rather than reactively. When we understand how mental health affects learning and behavior, we're less likely to interpret a student's struggles as willful defiance or lack of effort, and more likely to respond with empathy and flexibility and appropriate supports. So now we'll come back to protective factors, which I know we discuss often within these webinars. And these are the conditions or the attributes that help students cope with the stress and reduce the impact of risk factors. Again, that cushion, as that video described it. So we're going to talk about all of these just really quickly, and then our focus today really is going to be on social connections. But as we're talking about the concrete supports in times of need, this access to basic supports such as food, housing, stability, healthcare, and school-based resources, they help reduce the stress and allow students to focus on learning rather than on survival needs. We also have the knowledge of development, right? That understanding of typical child and adolescent development helps us as educators set realistic expectations and respond appropriately when student behavior maybe reflects developmental need rather than intentional misbehavior. And we come to the social connections, right? The positive and consistent relationships with peers and trusted adults that helps students feel safe, valued, and supported. And this is one of the strongest protective factors within the school setting. We'll hit on next resilience, right? This is strengthened when students experience encouragement, problem-solving support, and opportunities to recover from mistakes, helping them cope with challenges more effectively over time. And then lastly, the cognitive, emotional, and social competence. Teaching skills such as emotional regulation, communication, and decision-making supports students' ability to manage emotions, navigate relationships, and respond to stress in healthy ways. As I stated, one of the strongest protective factors for students is social connection. Even small, consistent actions can strengthen a student's ability to cope and succeed even during challenging times. So we'll spend a bit of time today discussing simple ways that we as educators can support these social connections with students. And I love all these things that are being put in the chat. Thanks for prompting that, Tara Kay, talking about some of those protective factors. I appreciate that. So research shows that no significant learning occurs without a significant relationship. And I think this highlights a key truth that meaningful learning requires meaningful relationships. Building these relationships isn't accidental, but it can be an intentional act that shapes your entire classroom or school culture. Everything from your interactions with your students to how you set up your classroom or your small group area to your lessons and to your family communication shape your ability to build meaningful relationships with your students. Maslow's hierarchy reminds us that students must have their basic needs met, such as safety, belonging, and emotional security, before they are able to engage in higher level learning. When students do not feel safe or connected, their brains are focused on survival rather than academics, which is why relationships and emotional safety are foundational in schools. They create the foundation for trust, for engagement, and for risk-taking and learning. I love, Kyla, that you shared that quote, Maslow's Before Bloom. That's one that I've heard before too and really appreciate. Right, all of this information helps us reframe relationship building into something that actually can be instructional, not just something that's extra. So we're going to spend a little time now talking about some simple strategies that can help you build relationships and social connections. And it's important to recognize we're kind of starting with this foundation and with these ideas of building protective factors before getting into talking about some of the mental health disorders that you might see students experience in your school, because these are strategies that can help with all the students that are coming through your school and through your classroom. So we'll start with connection strategies. This is one of the simplest and most effective ways. I'm sorry, the greeting students, which is one of the connection strategies. And it's one of the most simple and effective ways to build connection with students. Greeting students at the door sets a positive tone for the day. For some students, especially those who might be experiencing anxiety, stress, or instability outside of the school, this may be the first positive interaction they've had for the day. That brief moment of connection can help regulate emotions and increase a sense of safety before instruction begins. Using eye contact, a smile, and a personal recognition, such as using the student's name, helps strengthen that relationship over time. It's also important to offer choice in how they are greeted. Choice supports autonomy and respects boundaries, which is especially helpful for students who may feel overwhelmed, guarded, or unsure about social interactions. Next, we'll talk about relate breaks, which are especially effective because they are short, predictable, and low stakes. They don't require deep sharing, problem solving, or a lot of academic effort. They just require presence and connection. These breaks could include things like would you rather questions with students, or a quick check-in prompt like, what is one thing that made you smile recently? Something really simple. These brief moments, which are usually just between 1 to 2 minutes, can help regulate the nervous system by giving students a mental pause and also creating a sense of belonging. These relate breaks are also an opportunity to model respectful listening, turn-taking, and curiosity about others. Using structured prompts or tools like a talking stick ensure students who want to participate have a safe opportunity to do so. Taking this 1 or 2 minutes to intentionally connect can save instructional time later and also give educators insight into student interests and stressors, which can help inform support later on. So the pulse meter is another great strategy that you can use. This is a simple way to help students pause and check in with themselves. It gives students language to identify how they're feeling and how much capacity they have at that moment. This strategy helps normalize that students come to school with a different emotional load each day. A student who is already overwhelmed may struggle with more frustration, focus, or flexibility. And that doesn't mean they're trying to be difficult. It just means that their system might already be under stressed and might already be at capacity. A pulse meter can be done verbally, it can be done visually or privately, and can be adapted for different age groups. The key is that participation should feel safe and not forced. Students in this situation don't need to explain why they feel a certain way. Identifying is enough. This strategy can help you as an educator anticipate the needs of a student instead of reacting to a behavior. When we know that a student's tolerance level is low, we can adjust expectations, provide support earlier, and respond with empathy rather than surprise when a challenge arises. Over time, this also builds emotional awareness and self-advocacy for students. Students begin to understand their own limits and communicate their needs more effectively, which supports both regulation and learning. And then the 2x10 strategy. This is a really structured way to build trust with a student through consistency rather than intensity. It involves spending 2 minutes a day for 10 consecutive school days, engaging in positive, non-directive interactions with students. During this time, the focus is entirely on connection, not instruction or correction. There are no expectations, no consequences, and no problem solving. This might look like talking about a student's interests, could be playing a quick game, or simply just being present and attentive with a student. What makes this strategy effective is the predictability. When students know they're going to receive consistent positive attention from an adult, especially an adult they might struggle with, they often feel more regulated and more willing to engage appropriately in the classroom. Many challenging behaviors are rooted in unmet relational needs. So the 2x10 strategy helps meet those needs proactively without requiring a lot of extra time and resources. And lastly, we'll talk about the positive home connections. These are powerful, often underused strategies for supporting student mental health and behavior. These interactions help shift the relationship between school and home from being primarily problem-focused to partnership-focused. When families regularly receive positive communication, whether it's a quick email, a short message, a note, or a brief phone call, it builds that trust and helps caregivers feel that the school staff see their child's strengths, not just their challenges. Also, it helps reinforce a sense of belonging and competence for the student. A lot of times, students, when they have these positive interactions as well, when they see educators noticing the positives, then when problem-solving conversations seem to come, both they and their families are more receptive, and the student likely feels more supported rather than singled out in those interactions. It's important to note these connections don't need to be time-consuming or formal. Even just small, consistent, positive interactions can have a meaningful impact on student well-being and long-term engagement. So I hope you see, and probably some of these strategies you've already used previously. These are things maybe that you're aware of and that you know about, but kind of understanding the why behind them is really helpful, and just a refresher of knowing that these really small engagements, these really small strategies can make a big impact for a student, no matter where they are on that mental health continuum. So really up to this point, we've focused on relation-based strategies that build that connection with students and families as a way to support mental health. Again, they're powerful and can support all students. As we shift now into discussing more about common mental health disorders that may be experienced by students in your classroom and in your school, it's important to pause just for a moment to discuss some cautions before we move forward. This slide is here to really help clarify our role as educators. First and foremost, we should be focused on recognizing concerns, not diagnosing mental health disorders, right? Diagnosis is the role of a licensed mental health professional. As educators, our role is to observe behavior over time, to notice changes from a student's typical baseline, and to pay attention to how those changes are impacting learning, how they're impacting relationships, and how they're impacting a student's daily functioning within the school setting. Also, mental health challenges are highly individualized, as each student's challenges will manifest differently and require a tailored response. The strategies we'll discuss related to each mental health disorder are not a one-size-fits-all solution, but they're flexible tools that can be adjusted based again on the student needs and alongside collaboration with school teams, family, and mental health professionals if they are involved as well with the student. So with those cautions in mind, I'm going to turn some time over to Tara Kay. She's going to shift into talking about some common mental health disorders that may be present with students in your classrooms and in your schools, and share some more specific strategies that could be used for students who are experiencing different mental health disorders. So Tara Kay, I'll turn the time over to you.
Thanks, Ashley. You always do such a great job at explaining those things. Thanks for going over those protective factors and those cautions. I loved the shark to-do list. I feel like mine's like a whale right now, but if you want to put in the chat what your to-do list animal would be or the size. But I think it's awesome, even for adults, for us to remember what can help us with our own mental health. I like that saying also, of we got to put on our own oxygen masks, right, to help others. So it's also important to learn about those things for our own mental health. So as we go into this, just know that we did not include all the mental health disorders in this presentation. We tried, there's a lot. If you've seen the DSM-5 and what it's up to now, like it's a pretty thick book, but we tried to highlight some that we feel like is very important in the school setting and are things that we felt like you would be beneficial to you to be aware of. So we're going to start off with neurological disorders. In neurological disorders, they are conditions that affect the brain, the spinal cord, and nerves throughout the body. There are many subcategories under this domain, but we are going to focus on those neurodevelopment disorders. So like dyslexia, dysgraphia, dyscalculia, and learning disorders that impact reading, writing, and math. Each disorder affects different cognitive processes and requires a tailored support to improve academic performance and to help their daily functioning. Early identification of these allows for effective intervention, including specialized instruction and accommodations, helping each of those individuals reach their full potential. If you also want to keep track of how many words I mispronounce, you're welcome to do that too. Hopefully not too many. We'll see. You can keep that tally. So we're going to move on to those learning disorders. They are distinct, but sometimes are related. Dyslexia, dysgraphia, and dyscalculia each impact different academic skills, reading, writing, and math. They require those targeted supports. Recognizing these challenges early can help with some of those preventions. Behavior can be a signal of those underlying causes. This might look like defiance. Students are avoiding or disengaging. It may reflect that underlying learning difficulty. Rather than, sometimes we see it as a lack of effort, but we need to be aware that sometimes there might be more going on. Behavior can be that signal that lets us know that maybe we need to refer or assess or talk to our reading specialist, right? Like, hey, I have concerns. I'm seeing, these similar signs. Um, I have a daughter that I remember when we went into COVID that I started seeing things that I was like, oh, I did not realize how long this is taking you. I did not realize how hard this was for you. And, none of the teachers brought it up to me, but at that time, like, I don't think they realized how much, she was struggling. I didn't even realize how much she was struggling, and she ended up being diagnosed with dysgraphia. And so I think sometimes these are easily missed, even by parents. So it's great to understand kind of those differences and those specific things that can come about with these disorders. I know that the district I worked in, they did great at providing resources to educators that list all the symptoms and signs. Sometimes dysgraphia can be pigeonholed into just writing, but it's not always writing. It can be misspelling. It could be the way that their brain processes information as they're outputting things. Some of you are probably familiar with some of the signs of dyslexia, but sometimes to me, you have to understand dyslexia is on a spectrum. So some things that affect one person might not be as challenging for another. Let's move on to talk about those behavioral strategies that can help with all of those neurological disorders. I also wanted to say, feel free to put your questions in the chat. We'll try to get to them at the end of the presentation, or if I see them on the slide, then I'll try to answer those as we go along. So effective behavioral strategies, it includes developing those clear routines, possibly using those visual supports or a visual checklist or schedule. Providing explicit instructions, step-by-step direct instructions can reduce that cognitive load. Flexible seating and scheduling those movement breaks can help meet those physical needs and teach that appropriate outlet. As we pre-teach and scaffold skills, we can reinforce those throughout the whole environment, setting your classroom tone and emphasizing that like growth and effort, it's okay to make mistakes, right? We kind of decrease that shame. I've seen this in students that, sometimes they really don't want to get up to the front of the class, right? And ask the teacher a question if she's by her desk or things like that. Realize that sometimes they observe that other students know they're constantly needing support, right? So helping to make sure that we're offering that pre-correction or that we're available to offer that support to them. This can include that specialized teaching and accommodations that they might need, proactively modifying reading, writing, or math demands, reducing the volume of work, using alternative formats to match the student's learning profile and prevent avoidance behaviors. It's important to view disengagement as a signal of those unmet learning needs and responding in support rather than consequences. Many of these interventions can be done universally in your classroom, but also can be tailored to those students with specific needs. Another thing I wanted to highlight is just how ADHD, autism, and dyslexia, they can sometimes share overlapping characteristics, also having those distinct features that are separate from each other, but also they may experience that neurodiversity and that co-occurring comorbid conditions. So understanding both the similarities and the differences can help you to, rather than oversimplifying their needs of, sometimes I saw this in schools, it's like, oh, well, they're autistic, so they need this, right? Rather than saying, these are the condition that they have and the symptoms that they have, and how can we address those more individually. So just being aware, some students that have ADHD and autism, they both kind of have those characters of struggling with their executive functioning skills, that attention regulation, whereas, autism and dyslexia can sometimes share those skills of language processing, communication difficulties, but dyslexia also has those separate skills of having those phonological issues, spelling difficulties, that letter reversal, sequencing. These are all things to be aware of. And yes, we will be sending the slides out, and the webinar will be posted on, well, we're sending them out, right, Tanya? They'll be posted to the website. Okay, so moving on, fetal alcohol syndrome is an umbrella term for a broad range of effects and symptoms that are caused by prenatal alcohol exposure. Individuals with, I always say this fast, but FASD is just harder for me to say for some reason, may experience a unique combination of day-to-day challenges, including medical, behavioral, educational, and social problems. These difficulties can include learning and remembering, following directions, being able to shift their attention, being able to control their emotions, impulsivity, their communication, and performing their daily life skills. People with FASD are more likely to suffer from other mental health disorders such as ADHD, depression, anxiety, problems with hyperactivity, conduct, and impulse control. And they have an increase in incidence of alcohol and other substance abuse disorders. Just for your aware, there are 4 different diagnoses for FASD. The one that I highlight on this screen, FAS, is typically one associated with the different facial features, but it is important that you're all aware that not all individuals that have FAS, they have those facial features. So there's partial FAS, which involves some but not all the characteristics of full FAS. There's also alcohol-related neurodevelopment disorder, which requires evidence of the prenatal alcohol exposure, and they have some abnormal or structural, but it can look different than what is depicted in this picture. Alcohol-related birth defects, ARBD, includes medical conditions linked to prenatal alcohol exposure, such as heart, kidney, and bone problems, difficulty seeing and hearing, reduced immune function, and is rarely, just a standalone. They usually have other things that contribute to those challenges. We also have neurobehavioral associated with prenatal alcohol exposure. So this requires evidence of that prenatal alcohol exposure and is indicated by those impairments in cognition, self-regulation, and adaptive functioning. Tanya put that website in the chat that these will be posted on. The reason why we bring this up is because I saw a lot of this in the schools that I worked on. Sometimes I know that DHHS has also reached out to us, the Department of Health and Human Services, just to want to educate educators on this more, and student support providers about that they, are seeing this underdiagnosed and not a lot of early intervention going on in this area. So it's really important to be aware of these signs and reaching out for support or more information from mental health professionals if you're concerned about those things. So we're going to move on to behavioral strategies that help with FAS. So some of these are just breaking things into smaller steps, giving one instruction at a time, using those checklists that we talked about, or visual aids, using a visual schedule. My favorite were the ones that kind of covered up the schedule as you went along. So kind of that lessening, that processing in there, reduce that overstimulation, creating a calm, low distraction environment by limiting exposure to loud noises, crowded spaces, or sudden changes. Provide that explicit social instruction to be able to teach those skills that maybe they developmentally didn't learn, being able to teach those emotional regulation and coping skills to manage their emotions, and preparing that student ahead of time for transitions, giving those advance warnings and reassurances of what to expect next. I think for me, what I think is vital for helping support these students is just making sure that you are addressing, like, they might have different symptoms, or they might have that comorbidity where maybe they have multiple disorders. And so this is one that I feel like that individualized plan is probably really important for. We're going to move on to our next one about common mood disorders. This is also a really broad category. I have that in the wrong order. Sorry, it is attachment disorders, not mood disorders. Sorry, I was like skipping ahead in my slides here. Attachment disorders stem from those early disruptions in forming secure emotional bonds. They're often linked to trauma or neglect, and they show up in a school as difficulty trusting others, social withdrawal, and challenges with relationships. Making those consistent relationships and being able to regulate those supportive approaches is really helpful in the school setting. Those therapeutic focuses really focus on building that trust and regulation skills. So we're going to talk about those and the behavior strategies of how we can kind of help support that. Those behavior strategies for mood disorders. So encouraging that participation even when motivation is low. I always say, like, they can't improve if we're not helping create those opportunities, right? If any of you have teenagers, you know that one day you say something and it's fine and it's good, and the next day can be a complete opposite reaction, right? We all get that. So encouraging, keeping those opportunities there. Also, another thing is, that having that peer involvement. There's things that my daughter will do with other people that she will not do with me, right? So sometimes having that motivation of that peer support really helps. Positive reinforcement is very important. Giving praise on any and all efforts. So even if they, stepped foot in the door and then decided, no, this isn't for me, I'm leaving, at least they tried, right? At least we made it to the door, right? Establishing those routines creates kind of that predictability and helps stabilize those modes. Mood. I know that when we have those things scheduled, then it kind of starts to become habit, and sometimes there's that less resistance. Teach them how to identify those emotions that they're feeling and those moods, utilizing that calm corner or calm room to help support that regulation. And teaching those coping skills of whatever they prefer. I think it's really important for students to come up with their own coping skills. Sometimes that really helps with that motivation. Self-advocacy skills, I feel like, is very important in this, teaching them to advocate for what they might need in these situations and being able to be comfortable asking for accommodations or things that they might need to help them feel more comfortable when they are doing things that they don't want to do, right? Teaching problem-solving skills, providing those flexible deadlines, chunking assignments, providing those opportunities for breaks. These are all things that would be helpful to kind of address some of those regulation challenges that they're experiencing. So we're going to move on to anxiety. This is one of the most common, I feel like I hear a lot of questions about anxiety in schools. Anxiety can show up in many different ways. It can often look different from student to student. There are 11 anxiety disorders, and they're all classified as distinct categories that are separate from mood disorders. Common symptoms may include restlessness, feeling on edge, difficulty concentrating, irritability, and sleep disturbances. In the classroom, this may look like frequent worrying, trouble focusing, emotional reactivity, or appearing easily overwhelmed. One of the most common ways anxiety presents in school is through some of those avoidance behaviors. So this might look like that refusal to participate, frequent requests to leave the classroom, running out of the room, avoiding specific tasks or people, so certain environments, any situation that makes them feel overwhelming. Avoidance can sometimes be, misunderstood as defiance or that lack of motivation. But for students with anxiety, it is really often just their attempt to reduce their stress. Unfortunately, avoidance tends to increase anxiety over time rather than reduce it. So what that means is the more they avoid those situations, the less that they're able to tolerate them, and their tolerance level for things will decrease. So let's talk about some of those behavioral strategies that can help them with their anxiety. So most important, trying to provide those scaffolding opportunities to engage in the provoking task instead of just removing the stressor entirely. So what we would do is we break it into more manageable steps so the students can experience some of that success without becoming overwhelmed. Breaking stressors into smaller steps. This might look like completing one problem at a time, starting with a partial task, practicing a skill in a different setting before doing it in front of others, encouraging them with meaningful activities. So things that they enjoy, but also will help them kind of get that dopamine rush going, right? Such as exercise, sports, arts, or hobbies. Even when anxiety is present, avoidance can feel helpful in the moment, but continued, disengagement won't support their emotional regulation or their resiliency in those situations. Also, being able to support students with their challenging, anxious thoughts. This is another really important component. This includes helping students identify kind of those automatic worries and those automatic things that they are fearful of. Anxiety is based on that fear. Examine the evidence for against the fear and for the fear and replace it with more kind of realistic supportive self-talk. A calm corner or a calm room can be used to regulate. Thanks for putting that in the chat. I love it. Right? Increasing that tolerance. I love that little shark in there. That's great. Thanks for sharing that. So teaching those coping strategies and skills such as deep breathing, grounding techniques, or positive self-talk gives the students that ability to use both outside the school and inside the school. I just want to highlight that gradual self-exposure to feared situation is very effective when reducing anxiety over the time, but this should only be done with support, encouragement, appropriate planning, having that trusted adult or peer present during those exposure times can help increase that confidence and success. Really important to remember that exposure strategies are not appropriate for students experiencing trauma or PTSD and should only be implemented by a trained mental health professional in certain cases. And so we're not talking about exposure therapy. We're just talking about increasing a student's tolerance, helping them navigate those situations at schools that are causing them some anxiety, and kind of being able to do that in appropriate ways with that adult support and helping motivate them. And so I think a big part of this is also talking to parents and helping, the parents understand, like, this is what they're struggling with, like, how can we better, support them and help them handle these challenges better. All right, so our next mental health disorder that we're going to talk about is post-traumatic stress disorder, PTSD. This can develop in students after experiencing or witnessing events that overwhelm their ability to cope with that event. So some things that might be overwhelming to me are different and overwhelming to you, right? These experiences may include accidents, violence, abuse, neglect, or other significant stressors. In the school setting, PTSD can be hard to recognize because symptoms often overlap with a lot of these others: ADHD, anxiety, oppositional defiance disorder, which we'll talk about. A student may appear inattentive, irritable, emotionally reactive, or withdrawn, which can lead to the misunderstanding that there is underlying trauma that maybe we haven't considered. So in this, I think it's always a good idea to reach out to families, reach out to parents, and ask those questions about, like, hey, I've seen this change in behavior, or this has anything concerning been going on? Some of those common symptoms include intrusive memories or flashbacks, avoidance of reminders, changes in mood or thinking, hypervigilance, and sleep disturbances. In the classroom, this may look like sudden emotional shutdowns, heightened reactions to stress, difficulty concentrating, or strong responses to seemingly minor things that maybe we don't pick up on what those triggers might be. These symptoms can also impact relationships, learning, daily functioning at school. They struggle to feel safe or regulate emotions or be able to trust the adult or even with peers. So we're going to talk a little bit about how we can help them in that school setting. So once again, I know some of these are the same in some of these different disorders, but they're relevant specifically to these certain ones. So creating those clear, predictable expectations and routines. When students know what to expect, their nervous system is less likely to stay in that heightened state of alert, which helps support their focus, their regulation, feeling safe. Teaching those relaxation, those grounding skills is also really important. Grounding techniques help students shift attention from present moment when they feel overwhelmed. These can include deep breathing, sensory, brief mindfulness activities. A calm corner or calm room provides that safe space. It's a non-punitive space for students to regulate with emotions and help to de-escalate. The goal is not to avoid the work, but helping the student return to learning after they've had a chance to calm and regulate themselves. Individual planning is really important for students with trauma history. This may include an individual safety plan or support plan, identifying what those potential triggers are, planning ahead for situations like, fire drills, substitute teachers, schedule changes. I know 9 times out of 10 when I got a call, about a situation, sometimes I'd be like, was the teacher there today? I've been working with the teacher. And they'd be like, no, the substitute was there today. I was like, oh, okay, got it. That explains a lot, right? So making sure all staff are aware, sometimes giving them some forewarn of like, hey, this student has some specific needs. I need you to make sure that, we're not triggering this student. Providing a menu of options for assignments or tasks help reduce anxiety by offering a sense of control without lowering expectations. Choice can increase engagement while still maintaining structure. Allowing that creative expression, such as journaling, art, music, this can be a very powerful tool in emotional processing and also an outlet for them to express some of those feelings. Our role is not to push students through their distress, but to create those conditions where they can gradually build that confidence, trust, and that capacity to learn. All right, we're going to move on to obsessive compulsive disorder. These last ones I'm going to try to go through a little quicker so we can get to any questions that you might have. So obsessive compulsive disorder is characterized by intrusive, unwanted thoughts, so obsessions, and repetitive actions, which would be considered compulsions. They are performed to alleviate anxiety caused by these thoughts. OCD can significantly interfere with functioning. They can disrupt learning, attention, task completion, relationships, especially when the obsessions or compulsions take up a large amount of time or mental energy, affecting their daily life. Some of the strategies that will help with these things is just sometimes delaying and distracting in those moments. We sometimes have that urge to perform, that compulsion arises if we delay it for a few minutes or engage in distracting activity, drawing, listening to music. That sometimes helps. Limiting reassurance seeking. So this might sound weird of like, well, we're supposed to reassure them, but reassurance can unintentionally maintain OCD symptoms. So OCD can significantly, impair them. And sometimes when we are reassuring, we can sometimes not give them the support that they need. And so we need to replace that reassurance with those like affirming statements, coping statements like I can handle this, like what has helped them in the past, pointing out those things that are reassuring, but also kind of provides that motivation. Creating a personalized coping plan of their symptoms, creating those predictable expectations and routines, providing flexible deadlines for them, providing structured notes. Sometimes it's anxiety that you're not, right? Sometimes those compulsions can rely on not doing the right thing at the right time, and I'm not going to know what to do. And then just like we kind of talked about, their strategy should be adjusted based on those specific thoughts and those specific actions. So around their obsessions and compulsions will really help those students. Oppositional defiant disorder, ODD. This is a behavioral disorder seen in children characterized by defiant, disobedient, and hostile behavior towards authority figures. Some of us might say, like, well, every teenager in the world has this, right? These are really, when we characterize this, it's persistent patterns, very irritable moods, argumentative, frequent temper tantrums, the refusal to comply with rules. These are things that are affecting their daily life in a significant way. So early intervention through therapy and parental involvement is important, and to help them with healthier coping skills and helpful, more problem-solving skills. So, and we kind of talk about that more in our behavioral strategies. So also recognizing, sometimes we know that our kids can be labeled. I am very conscientious that I don't ever use a student's diagnosis. This is just a condition that they're experiencing. We need to address their behaviors, even though you might know that they have a diagnosis of ODD, right? But you also might not know, right? And so sometimes these are persistent signs that you should be aware of, but these are still strategies that we can help with students that are experiencing some of those same characters. So recognizing their strengths, providing that positive reinforcement, offer choices when possible. This helps give the student a sense of control without compromising structure, creating clear, consistent routines, establishing those predetermined consequences, and then also being able to maintain and build that relationship. Okay, so when and should we access support, right? So I'm just going to go over these briefly. As you look for signs that are persisting over time and impacting the student's functioning, these would include social withdrawal and isolation, a sustained shift away from friends and group activities, a decline in academic performance, such as sudden drop in grades, or having lots of missed assignments, noticeable mood and behavior changes like aggression, extreme mood swings, or repeated emotional meltdowns, frequent physical complaints, headaches, stomach aches, but you're not finding like a real medical cause. Parents are saying there isn't a medical cause, and most critical, risky or self-harming behavior, so including self-inflicted injuries, expressions of hopelessness, or those suicidal thoughts. Okay, so this is when we should be aware that we need to access that support. So if you observe one or more of these signs persisting and impacting the student's functioning, it is appropriate to consider involving mental health professionals and following your school's formal referral process to engage in this full continuum model. So the full continuum of care describes a model that supports provided by community providers, a tiered layered system of support that is designed to address students' mental health needs. If you notice, the arrows are pointing both directions. Students are able to move up and down from the continuum of care of what they might need and the level of support that might be appropriate. Some supports can be accessed within your school community, but mental health professionals such as licensed clinical social workers, clinical mental health counselors, psychologists, psychiatrists, they are the licensed providers to provide that diagnosis and treatment. If a student needs community support, it's important to know where to access those supports. We've included some resources here, mental health agencies, those local mental health authority maps, 211, We'll give you a list of those community resource agencies for immediate help and support. We would reach out to Safe UT, 988, chat or text. Also, we have some youth crisis care centers. We have our mobile crisis outreach teams, MCOT, and Stabilization Mobile Response, SMR. They are available to help youth in their homes or community. Please connect with your school's mental health staff for more information or if you need more support. And we've included also some resources. Those will be on the website. We really appreciate your feedback on what else we can include or how else we can help support you in that school setting. Sorry we ran out of time, but I'm happy to answer any questions that anybody has.
And thank you, Ashley and Tara Kay, for sharing this awesome information with us today. Just a quick reminder, if you could give us your feedback on today's webinar, we would really appreciate it. You can scan the QR code, or Mindy's just put the URL into the chat, and you can use Tara Kay Bodley or Ashley Lauer as the trainer today. We'd be grateful. Also, just a quick reminder, next month's webinar will be covering cybersecurity. We'll be talking about a gap analysis and best practices for cybersecurity, and that will happen on March 19th, always the third Thursday of the month. Thank you so much for joining us today, and we hope to see you again in the future. We have just 3 more left in the year. We hope you can join us for those. And have a wonderful day.